You're listening to the Food City Podcast, the show that takes you behind the scenes of your favorite supermarket.
From new products, expert tips on meal planning, and all things community, let's dive in and see what's in store today.
Well, hello, everyone, and welcome again to the Food City Podcast. I'm Nicole, Food City Dietitian, here again with Megan, who is a Food City Pharmacist. And today we are talking about GLP-1 medications.
Yes.
They have certainly garnered a lot of attention in recent years, I would say. So what do you think has been driving this?
They've gotten really popular recently, and part of the reason is because they are such a great drug. I mean, they're showing such exciting studies with diabetic patients being able to lower their A1C and getting it lower when other medications and other therapies have failed. Mm-hmm. So it's been really promising in that aspect. You've got patients who are also losing weight on it. So that's also, it's a side effect, but it's also another reason that they use it, and that's just really big for diabetic patients because it can help prevent the long-term complications in the long run, like heart disease, nerve damage, and things like that. Mm-hmm. But another reason I think it's gotten so popular is because of the social media attention that has come along with it, especially with influencers and online communities really helping spread the awareness of the positive impact of the drugs. Yeah. And a lot of people realizing that the weight loss is such a big component of it and using it for that aspect. So I think that's really helped kind of propel it into how popular they are now.
Yeah, absolutely. I feel like in the clinical world, we talk about its use for diabetes more so, but I think more on that social media aspect that you were touching on, a lot of the attention has been around weight loss. So why don't you kind of clarify who GLP-1 medications are for and how they work?
Well, they are indicated, depending on which one you have, they're indicated for type 2 diabetes, but there are also certain brand names that are indicated for weight loss for patients who are obese who are overweight that have comorbidities that go along with it. So you want to try and reserve number one for the diabetic patients, but it does have the FDA indication for weight loss as well. Yeah. So that is an option for them. And then a couple of them have gotten newer indications. Ozempic in particular is now approved to help prevent cardiovascular events, and it's got a new indication to help with CKD or chronic kidney disease to help keep that from worsening. So it's starting to expand its role, but the main reason for them were for diabetic patients, type 2 diabetic patients. So basically what these medications do is they mimic a natural hormone in our body, GLP-1, which is the glucagon-like peptide, and it helps your body produce insulin when blood sugar is high and reduces the amount of blood sugar that is being made. It also helps slow how quickly food goes through your stomach, so it helps you keep fuller longer, and that's kind of how some of the weight loss is happening as patients are reducing their calorie intake because they're just not eating as much. So
yeah. And tell us a little bit about some of the common side effects.
Yeah.
Because if there's delayed gastric emptying, if it's not moving as quickly as you're used to, that has to bring with it some side effects.
So the number one most common side effect is nausea, and that can be just a minor nausea, or some people it's pretty severe. So they try and usually start you on a low dose and taper it up to kind of get your body used to it. Those side effects usually do go away over time, but some patients kind of have it constant and just can't tolerate it. That's the most common one. Vomiting or other GI side effects are probably some of the other ones. Headache and fatigue are possible, but they're not as common. So I'd say just the number one complaint is some nausea and the GI side effects that come with it.
The digestive issues. You mentioned that you would expect them to go away most of the time. They go away over time.
Yeah.
As if dosage increases, do those side effects come back typically?
They can. I've had some patients that I've talked to who have been increased to the next dose, and they haven't had any problems with it. But then I've had patients who have told me they've gone up and they just couldn't tolerate it and had to go back. So it really is patient-specific with it.
And I think another big question and concern for a lot of people that comes up is, will I have to be on this for the rest of my life? Say the goal is weight loss or better blood sugar management, and both of those things, or one, if that's the goal, comes under control. Will a patient need to continue taking these medications long-term?
And typically GLP-1s, they do work best when they're taken long-term. If you stop taking them, then your blood sugar and weight might go back and sometimes have gone back to what it was before. And that comes down sometimes to whether you've made the lifestyle modifications to go along with it. So you don't want to take this medication thinking, I'm just going to take this drug and continue doing everything else I've been doing that might have got me to where I am, and it'll stay the same. So you want to try and like make the lifestyle modifications, work on your diet, be more active. So some patients might be able to come off of it or come down on it and still have, the lasting effects. So
yeah, it's really up to monitoring over time if you can continue successfully through just lifestyle modifications. Now, I will kind of talk a little bit later on about some specific nutrition recommendations for individuals who are taking GLP-1 medications, but tell me a little bit about if there are any food and drug interactions, things that are contraindicated if you're actually taking GLP-1s, or is it kind of individual tolerance?
Yeah, I don't know if I would say food as a interaction, but if you eat too much food while you're on these medications, you could become overfull, start to get indigestion. So you really want to try and monitor. Sometimes people will eat 3 or 5 smaller meals throughout the day instead of big meals to kind of keep themselves from feeling uncomfortable in that way. Some medications that can affect your blood sugar if you're taking other diabetic medications can cause your blood sugar to go down too much. So you want to work with your healthcare provider to find the right plan for you. Another big concern if you are on these medications and you have to have surgery. A lot of surgeons and anesthesiologists are really concerned because it slows down your gastric emptying, that it can increase your risk of aspiration or complications from that. So they usually, talk to them, obviously, if you're going to have surgery or anything, but usually they'll recommend stopping it a week or 2 ahead of time to try and get everything out and get it, working properly so that you won't have that risk as you're going into surgery. So
yeah,
and that's one of the big ones that people just kind of need to remember.
Yeah, absolutely.
Yeah.
You mentioned Ozempic. I think you kind of tossed around maybe a few other names, but what are the most common because it's a whole class of medications. So what are the most common on the market, and maybe what are some others that people have less of a kind of colloquial awareness of?
Yeah, so probably the original ones or the older ones you don't hear or see as much about, especially, in the social media or just the popularity of it is not as much, and that would be the Bydureon and Byetta. Trulicity is seen, you use it, but it's not as popular as well. 2 of the most common ones are semaglutide is the generic, and it comes under the brand name of Ozempic and Wegovy. And Ozempic is the diabetic indication, and Wegovy is the brand name for weight loss. So that one is what you see a lot in the commercials, and it's pretty popular. And the other one is tirzepatide, which is Mounjaro and Zepbound. Mounjaro being the diabetic brand name, and Zepbound being the weight loss. And that one actually is a little bit different. It is a GLP-1, but it works on another hormone too, the GIP, which is the gastric inhibitory peptide. So it works 2 ways, and it helps with the food noise and just kind of has that extra element in it to help with lowering your blood sugar, but then also the appetite control and things like that. So those 2 are the 2 most common ones used, though.
Got it. Now, we talked a little bit about some of the common side effects. Are there anything that are long-term risks of taking the GLP-1 medications? Because I think that is a question that comes up anytime you are taking any medication, but especially you mentioned a lot of them have to be on it long-term. So what would that look like?
Possibility pancreatitis is it's not common at all, but it is, it can be serious. So if you start to notice severe stomach pain while you're on it, you definitely want to see your healthcare provider. Another thing is thyroid issues. There's been some studies, animal studies, that shown a link of that to thyroid tumors. They're not sure if it, goes to people, but that's something to kind of keep in mind. And just a good general rule is to keep getting your physicals and your labs done, just to kind of stay on top of things and just make sure everything's running good while you're on them. And in general.
Yeah.
And then another thing is maybe kidney problems, because when you're on these, a lot of times you could, be nauseous or vomiting, or also just not eating and drinking as much as you should, can get dehydrated, and then that can lead to kidney problems. So you just want to make sure that you're trying to, stay hydrated and do things like that to prevent that one from happening.
Yeah, absolutely.
Yeah.
And then always just checking in with your healthcare provider, reporting the symptoms, because you really never know if something is out of the ordinary. It might seem ordinary to you, but it could indicate something else is going on.
Yeah.
So
I mean,
that's key.
speaking of like the appetite, digestion, dehydration, things like that, I mean, I'm sure that's when people can come to you and ask, you know, this is really, I can't tolerate it, or what can I do to make it better? So do you have, like, what suggestions would you have for somebody who might be coming to you? And
Yeah, you mean with symptoms or side effects?
With the side effects.
So especially with something like nausea, and we'll kind of get into some key nutrients that are recommended during if like a phase of weight loss, or even if it's taken for blood sugar management. But a strategy with nausea, I would say, is typically what's recommended is eating colder foods or foods at room temperature versus hot foods, because that can exacerbate the symptoms a little bit. And sometimes certain like tough meats, fatty foods, spicy foods, that can cause it to be worse. And so sometimes liquid sources of meals, if you're trying to get protein in, a liquid source of protein can be better tolerated, or softer foods can be tolerated too. And just like you would recommend somebody who is sick, we typically think of like saltine crackers. Salty foods actually can help ease the nausea too.
Yeah.
For something like if it's other GI issues like constipation, making sure you're consuming lots of fluids, of course, because you mentioned the delayed gastric emptying and reduced appetite as a side effect. So if you're consuming less overall, you're probably consuming less water too.
Right.
And so making sure you're prioritizing hydrating foods and hydrating with beverages as well.
And I always like to remind patients too that you still need to eat. I mean, I've had some people say, I just don't eat dinner. I only eat one meal a day because that's all I'm not hungry.
Yeah.
And I always try and stress, and I'm sure you would too, that you still need to fuel your body. Whether you feel hungry or not, you need to do something. Like make your calories count when you do eat them.
Yes.
But definitely still need to fuel it.
Absolutely. And that you made an excellent point. So prioritizing those nutrient-dense foods, because every bite really does count.
Right.
Really, we want to encourage healthful foods all the time, whether people are seeking weight loss or better blood sugar management, but especially if you are on a calorie deficit, whether that is through restriction intentionally or through a medication or some sort of outside tool that you're using to manage your appetite. That is when you really have to be careful about calorically dense foods versus nutrient dense foods.
Right.
So things like fatty cuts of meat, they're contributing a lot of calories, but not a lot of nutrition. Fried foods, ultra-processed foods. I know we say that word a lot. What does it really mean? But things like salty snacks and sweets and added sugars from beverages are going to be less rich in nutrients like vitamins and minerals, but contribute a lot of calories too. That is another strategy, too, for managing nausea, if that's a side effect, is having smaller and more frequent meals. It doesn't necessarily mean that you're grazing all day, because that's not what you want to do, either for better blood sugar management or for weight loss. But maybe having small, planned 3 square meals a day, and then planned small snacks as well can be a good strategy.
A lot of people, I think, get confused with you talking about protein. And I think it confuses a lot of people of how much protein you should eat. So do you usually have a set amount that you recommend to others? Because I know there's a lot of information out there that may not be accurate. So.
So it can depend. And let me talk a little bit kind of about the importance of protein, especially during a weight loss phase. So if you are at a caloric deficit and you're losing weight, especially if you're losing weight very rapidly, unfortunately, some muscle loss is pretty much inevitable.
Right.
That just happens. You lose some fat, but you also lose muscle. And what happens when you lose that muscle is your metabolism goes down. Now, that's going to happen when you lose weight. That's appropriate. But unfortunately, if the muscle loss is accelerated, your metabolism is going to decrease that much more. And so having adequate protein intake can help to offset some of that muscle loss and preserve some lean tissue.
Yeah.
When coupled with resistance training exercises. So that's really important. So protein is obviously going to be found in animal products. That's what we typically think of, like meat and poultry. Seafood is going to be a great lean source, but then also protein supplements can be beneficial as well. And to answer the question about how much, it does depend on the individual. So a bunch of different factors can come into play. So your height, weight is typically the biggest one. So current weight and then goal weight can come into play as well when you're calculating a protein goal. For general healthy people who are not losing weight, the traditional recommendation for protein is 0.8 grams per kilogram, which is really quite low. I think people are shocked to hear that. However, for GLP-1 users, people who are currently losing weight, especially if it's rather rapid, it does increase to 0.7 to 1 grams per pound of body weight. So that's significantly higher. That's about double the kind of traditional recommendation.
And can you get too much protein? Is there
a
fine line that you...
So I would say yes. The biggest concern of having too much protein is it comes while neglecting other nutrients. So that is the biggest concern. A lot of people hear about kidney issues. Now, if you don't already have chronic kidney disease or other comorbidities that can put you at risk for kidney disease, it's less likely to impact your kidneys. If you're not using it and you're not active, then it really is going to be excreted in the urine, and it's waste product.
What other nutrient deficiencies do you think that people who are on GLPs need to kind of just keep in mind?
So one thing that can be neglected oftentimes is fiber, especially if you're prioritizing protein. So protein is because people tend to eat more meat, of course, and there's no fiber naturally found in animal products. It's found in plants, so fruits, vegetables, beans, whole grains. And fiber is especially important, one, for weight loss because it can help us to feel full. So to complement the effect, if that kind of reduced appetite is what somebody's looking for, fiber can help with those feelings of fullness as a lifestyle modification, but it also improves overall health and longevity. So people who tend to have higher fiber intake, eat lots of plant foods, they tend to live longer. They have lower rates of heart disease. It also helps with digestion. So back to some of the GI issues that we talked about, increasing fiber can help with that. And then for people who are seeking better blood sugar management, fiber is going to also help manage blood sugar levels as well. And so if you're eating too much protein and it's coming at the neglect of other important nutrients like fiber, then that can be an issue. I also think anytime people are seeking to kind of just improve health or going on some sort of diet, the knee-jerk tends to be to cut out carbohydrates. And so anytime you're cutting out carbohydrates, fiber is going to go with it. And so that is one nutrition recommendation that I would give to people, is kind of making sure you're balancing your plate with protein, but you also have some fiber-rich carbohydrates on that plate as well, and some healthy fats. And so that brings my kind of other nutrient recommendations. And in terms of deficiencies, if you're decreasing your intake of fat, whether from animal products or just from kind of oils, nuts, and seeds, because you don't feel full, or you're just kind of trying to be more calorie conscious, you're less likely to absorb fat-soluble vitamins. So that's vitamin A, vitamin D, vitamin E, and vitamin K. Those are what we call the fat-soluble vitamins, so they require a little bit of fat to be optimally absorbed. And so, and that can come when you're decreasing your intake of anything, even if you're consuming the appropriate amount of fat, because your caloric intake is lower, your intake of vitamins and minerals can be lower too.
And I think that's really important to just bring to people's attention, because it's something you may not think about, being deficient in the fat-soluble vitamins if you're lowering your fat intake. So that's definitely something that I'm glad you're pointing out, because I'm sure most people don't think of something like that.
Yeah, absolutely. And I think too, just deficiencies in other nutrients, if you're cutting out entire food groups, that come into play. So if you're kind of not prioritizing grains, you're going to probably be missing out on a lot of B vitamins. Fortunately, you can get some of those from eating protein and stuff like that, but there can be kind of a cost to cutting out any food group.
Yeah. And then what about like deficiencies if you are experiencing the extreme nausea, like electrolytes?
Oh, yes.
Is that something to definitely
absolutely
keep in mind?
Especially if there's nausea or even vomiting. Now, if vomiting is ongoing, of course, that's kind of an emergency situation that you should definitely sort out with your healthcare provider, whoever is prescribing those medications. But if there is that nausea, lower appetite, and you are becoming dehydrated, then with that comes electrolyte losses, so sodium, magnesium, potassium, calcium. And so it could be beneficial to prioritize some sort of electrolyte beverage. I wouldn't say that is indicated for all people because we know most people are getting enough sodium especially. However, if you're decreasing your caloric intake, then it may be beneficial to add in some sort of electrolyte supplement. But I would say focusing first on food sources of those things. So sodium is kind of easy from salty foods, but you can get potassium and magnesium by prioritizing fruits and vegetables and nuts and seeds and legumes.
Yeah. And speaking of nuts and seeds, is that one of the good protein sources that you would recommend if somebody is having nausea and you can't tolerate the other protein sources possibly and they want to try and increase their protein?
Yeah, absolutely. Now, I would say I love encouraging plant-based foods, plant-based proteins in particular, because there are so many other nutrients that come with it. However, in terms of protein to calorie ratio, nuts are going to be a little bit on the lower end. But absolutely, if somebody is kind of struggling with nausea, trying to find other sources that work for you, because it can come down to individual tolerance too. Everybody's different in what they're going to respond to. But I would say prioritize first lean sources, avoid fatty or fried foods, anything spicy that's going to make it that worse.
Right. You just kind of touched on my next question. I was going to ask what people should avoid, and the fried foods, spicy foods, things like that is probably at the top of that list.
Well, just for overall health too, we don't want to be consuming a lot of fatty foods or fried foods. But yeah, absolutely, if you're experiencing nausea. And then it really kind of goes back to that point of making every bite count. Yeah. So while you are on a restricted diet, you want to prioritize nutrient-dense options as opposed to more calorie-dense options. So I would avoid sugar-sweetened beverages. One, it's not good for your blood sugar, but also because it's going to come at the cost of other things that you should be eating.
At this point.
Yeah. Alcohol would be another source of what we say are kind of empty calories. It can also actually lower blood sugar, so that would be something that if you have diabetes to take a look at. And then I would say focusing more on kind of smaller, frequent meals and planning those meals is going to be the best strategy.
Yeah, I think planning and meal prep are some of the big ways to kind of be successful on this. So I know we talked a little bit last time, but what are some tips about meal prepping and planning that can kind of help your life easier throughout the day and just help you kind of be successful and meet those goals?
Yeah, well, because we talk so much about protein in particular being so important, I would say having some quick go-to sources kind of at the ready. Breakfast and lunch can be difficult for a lot of people because you're like rushing out the door. You don't have a lot of time to prepare. So anytime, if you have time on the weekends to cook and do all of the meal prep, that's fantastic. But if not, then what are some convenient choices that you can have in the fridge or in the pantry that are just ready to go? So having some hard-boiled eggs, whether you're making those yourself or you're buying them from the store, can be a great option. Or just cooking eggs, is pretty quick, relatively quick. Protein shakes, and so I think a supplement can be a great option if you find something that's low in sugar, low in fat, but higher in protein. Milk, we kind of neglect talking about that, but that's a really good source of protein, and it has a bunch of other electrolytes and stuff like that are beneficial. And I would also say pre-cooking, chicken, having some frozen or canned fish, seafood, pre-cooked shrimp is a great option to kind of just throw into a stir fry or a quick pasta dish even that can be super convenient. I would also say making sure you're prioritizing, again, those fiber-rich foods like vegetables. So roasting vegetables ahead of time can be great, or having some pre-sliced kind of front and center in your refrigerator. You can just grab them and go. Right. Making sure that you're choosing foods that you actually like too, because you have to eat the foods to get the benefits from them. So if you're kind of torturing yourself with things that you hate to eat, then that's probably not going to be a great long-term strategy.
Very true.
I also think having some kind of quick cooking grains or pre-cooking grains ahead of time can be helpful. Yeah. So oatmeal is obviously an obvious choice for breakfast. It's relatively quick to prepare, but then for those longer cooking grains like quinoa, they have microwavable options, but if you have the time at the beginning of the week, I think batch cooking those, because you can save them and have multiple, repeat meals. Yeah. I think that's another key thing to keep in mind, is that not every meal has to be different. You don't have to be fixing gourmet meals. In fact, routine, while it can get boring sometimes if you're being overly restrictive, routine helps people stick to their goals. Yeah. And so it does not have to be eating 5 different things on 5 different nights, having those leftovers that you enjoy.
Yeah, because that can definitely get way too overwhelming for a lot of people, and then they just kind of throw in the towel or say, I'll start next week.
Yes, absolutely. So having the routine, really your go-to meals is going to help you kind of stay the path, but being flexible with those. So you're not treating it like a restrictive diet where if you go off of that, then you've blown it all. And that's where I think that tool of medication that reduces the appetite can be really helpful and reassuring for people too.
Yeah, I agree. I think these are, great drugs, and they are showing such positive effects with, helping people who may not have been able to achieve their goals or their glucose goals in the past. So it's really promising that there is another option out there. So it's just a delicate balance for sure. You want to make sure that the people who should be on it are getting it, and that they, are still fueling their bodies with nutrients and food, and and of course still getting their doctor's visits and healthcare, and just keeping everything in check. So.
Absolutely. And it is really so individualized. And I think that's where having meetings, consultations with your doctor, your healthcare provider, making sure that they're on the same page as the pharmacist, and also meeting with a dietitian can come in handy. But it really is kind of a nuanced topic, and we've just scratched the surface. I feel like we've talked about a lot, but at the same time, there's so much more to discuss. And so for those interested, you can find more information by signing up for Wellness Club, of course. There you can get coupons and discounts, specialized recipes, and expert advice from pharmacists, dietitians, and you can learn more about GLP-1s.
Yeah, sounds good.